This video encompasses the upper appendicular skeleton, and we're going to start with the two bones of the shoulder girdle or the pectoral girdle, known as the scapula, and the clavicle. So here's the scapula. Helps if I have my pen on. There you go. Scapula. And the parts of the scapula. This is from a posterior view over here on this side. And the one on the left is an anterior view, just so we can get our bearings. Let's look at the posterior view first and start naming some of the parts. Let's see if you know them. We'll start with the first pink arrow in the center. We'll label it A and see if you can label that part. I hope you labeled it the spine. That's pretty easy. You should be able to do that. Now, letter B will be the second pink arrow. I hope you put acromion on that. Because that's what it is. Now let's look at the area under the spine on the blade of the bone itself. Let's call it, I'm going to go ahead and label these things so we can come back and talk to them. E. E, because it's below the spine, has a nice long name. It's a depression below the spine. I hope you put infraspinous fossa. I won't spell that out. You can look that up. So what will be, let's see, E, F, G, the area above that spine. That's right, supraspinous fossa. Now we can go back and look at some of the other parts. Let's start with C. This is the edge of the vertebra away from the edge of the scapula, away from the vertebra, toward the armpit. It's called the lateral border. Also known sometimes as the axillary border. At the bottom, that's called the inferior angle. At letter D. Letter F then, if C is lateral border, you probably already figured out that F is the medial border, sometimes known as the vertebral border. H. If D is the inferior angle, then H is the, that's right, superior angle. Letter I. Let's see, we have a lateral border, we have a medial border. What can be that top one? Yep, superior border. That is exactly right. What have we left off? Looks like we got it all. Now let's look at the anterior view and name these special places on the anterior view. Let's start with, we'll call it number 1 right there. And then we'll have number 2 and then number 3. Number 1 is extending from the spine. Because it's extending from the spine, it is the acromion. Some books call it the acromion process. Number 2 is the other one. If you know number 1 is the acromion, that means number 2 then must be the other process, which you've hopefully got is coracoid. That's a little confusing though. Number 3 is the area where the humerus articulates with the scapula. It's the glenoid cavity. Now let's move on a little bit and take a look at that clavicle. Okay, so the number's on there upside down. That's okay. It doesn't impede our progress. We're going to start on the right side of the page with A and then move to B. Which end of the scapula is indicated at letter A? Well, you see it's more of a blunt edge, so that is the sternal end. And in some books, that is called the medial end. No, so what gives us on the other? That's right. B articulates with a part of the scapula. It's named because of that articulation. That would be the acromial end, sometimes known as the lateral end. Good. Oh dear, here's that humerus. Okay, first we'll label it humerus. That's nice to know. Notice the spelling. It's not R-O-U-S. It's R-U-S. Please get that. Here on the humerus, some easy parts to label like the head, the greater and the lesser trochanters. And then in between the two big bumps of the greater and lesser trochanters, we have that groove, which is called the intertubercular sulcus. This is wearing me out writing that one. Just like it will you on the practical. Now, from a posterior view, this is the humerus articulating with the ulna. So we have certain parts of each of those bones. The big depression on the posterior view of that humerus is called the olecranon. Fossa. The extension on that ulna is called the olecranon process, and it's kind of nice how they work together there. Now on the front side of that same humerus, the anterior view, let me just mark an edge of this bone so you can kind of see how it's fitting in there. There we go. We have the front of that ulna with that lower lip up at the hook of the ulna. We have a depression on the humerus. That depression is called the coronoid fossa, and its joined, so to speak, process on the ulna is called the coronoid process. Now let's move on. Here's our friend the ulna. Well, let's go back to that humerus for a minute, because one of the parts I couldn't label on that humerus because the bone was too big to get a really good shot of it was that deltoid tuberosity. Please be sure you know that it's about midway down on the shaft of that humerus on the lateral side for the attachment of the deltoid muscle. Here's our friend the ulna with its hook at one end and its head at the opposite end. Now on that head, that's what that one's referring to, there is a sharp little point, which gets the name of all the sharp little points, called the styloid process. Now, on looking at the view on the right, that's a good close-up of the other end, which is the proximal end of this bone. We have that olecranon process, which is the very large upper part of the wrench, if you want to think of it like a wrench. We have the lower lip, which is the coronoid process, and then we have the notch in between called the trochlear notch. Because it articulates with the trochlea, which we cannot see, of the humerus. The trochlea is kind of inside there. There's the mouth of that ulna right in there, and the fits on the trochlea of that humerus. So there we have the interaction of the radius and the ulna, which forms, of course, the elbow joint. Now I said that wrong. It was the humerus and the ulna forming the elbow joint. Now let's look at the radius. I was getting ahead of myself. This entire top of the radius, if we're looking at it from this end, is called the head. And it's on the correct end, the proximal end, if you want to think of it that way. Then we have a neck. Then we have this little bulge out called the radial tuberosity. And then down at the point, a point, which gets the name of all points, styloid process of the radius. Remember, we have to put that. This is going toward the carpal bones and going toward the thumb. The ulna is going toward your pinky. And here we have the hand. We have the groups of bones first, and we'll start with the finger bones, and you probably already know their names. I hope you do, and you've already named them as phalanges. Remember that episode of Bones where she was saying, dancing phalanges to the little baby. Then we have the middle row, which are in the palm of your hand, metacarpals. Then we have the set of bones more proximal on your arm, and those are called the carpals. Those are the teeny tiny little wrist bones. Okay, let's go first to the individual bones of the phalanges. Number 1 and number 2 of that. Number 1, because it's farther away from the point of attachment, is called the distal phalanx. It's singular of the word phalanges. And then number 2, the bone closer to the point of attachment, is called the proximal phalanx. This is the thumb, so it does not have the bone that the other ones have, and that's this bone over here called the middle phalanx. Now, let's take a look at those little wrist bones, and this is a really good picture of this hand. You find your thumb, come up, and find that first little bone right there, number 8. Number 8 is the trapezium, which goes to the thumb. So once you find number 8, go to the bone right above it, here. And that's where you start your so long top part. Here comes the thumb. So I'm going to write that in here. So long top part. And then you come, that P didn't make out very well. Then you come around to here comes the thumb, and that brings us back to the trapezium. So if we look at number 1, scaphoid. Number 2 with L, lunate. Number 3 with T, triquetrum. Number 4 with the P, pisiform, since that's how we're remembering it. Slamming your wrist down. Number 5 is hamate. 6 is capitate, and you see how the other bones kind of circle around it, so it's the head of the wrist. It's in charge. And then we have the trapezoid, and then back to my little friend the trapezium, which is to the thumb. And that's the end of the upper appendicular bones.